This is Kaylin Stevens, and I will be presenting to you guys about everything you need to know about fibromyalgia. So what is fibromyalgia? Fibromyalgia is a disorder characterized by widespread musculoskeletal pain accompanied by fatigue, sleep, memory, and mood issues. Researchers believe that fibromyalgia amplifies painful sensations by affecting the way your brain processes pain signals. Fibromyalgia is a chronic condition that affects about 5 million Americans. Doctors diagnose fibromyalgia based on a patient's symptoms and physical exam. Patients experience pain and stiffness in the muscles, but there are no measurable findings on x-rays or most lab tests. While fibromyalgia does not damage the joints or organs, the constant aches and fatigue can have a significant impact on daily life. So the history of fibromyalgia is not a new disease, but it's just recently that it's starting to get accepted and understood. In the early 1800s, it was first considered a mental disorder, first described by doctors as muscular rheumatism. At this point, the symptoms were stiffness, aches, pains, tiredness, and difficulty sleeping. Then in the early 1820s, a doctor in Scotland first described the tender points of fibromyalgia. In 1900, the term fibrosis was first used. Because inflammation, swelling, was thought to be a cause of the pain, the ending itis was given. In 1976, the name of the condition was changed to fibromyalgia. Swelling in the body was no longer believed to be the cause of pain. So there's some fibromyalgia controversies. Is it real? What is the relationship with other functional somatic syndromes? Can it be reliably diagnosed? Is it physical or psychological? Is there any effective treatment? Is a diagnosis helpful or harmful? And what is the role of rheumatology? Well, we will be answering some of these questions later on in the presentation. But I'm here to tell you the reason why I picked fibromyalgia as my topic is because my mom was diagnosed with fibromyalgia 7 years ago. And I can tell you right now, I know that it's real. I grew up watching her just be so tired and be in so much pain all day long, and there was no denying that pain and what she was going through. And it was hard for me growing up watching her like that because I didn't understand. And so I'm actually, just now through this presentation and just recently in these last couple years, I've taken an interest in getting to know, what my mom has been going through. So I'm a big believer in it, and I know that it's real based on everything I've seen from my mom. Not only my mom, we have several patients at the clinic who have struggled with fibromyalgia, and I can see it on them. I can see the pain that they're in and the stories they tell me of how they have to make adjustments to their daily life. Such as the way they get out of bed. It's simple things like that, and I know that what they're telling me is real. But more than just what I've seen through my mom and through patients, studies have proven that fibromyalgia is a real medical condition. In 1981, the first scientific study confirmed that symptoms and tender points could be found in the body. In 1990, the American College of Rheumatology wrote the first set of guidelines to help diagnose fibromyalgia. In 2005, the first guidelines for treating fibromyalgia pain were published by the American Pain Society, and in 2007, the first prescription medication was FDA approved to manage fibromyalgia. So, what is the outlook for people with fibromyalgia? According to the Fibro Center, the outlook has never been better for people living with fibromyalgia. Researchers continue to learn more about fibromyalgia, and as they do, they may also find new medications and other treatments to help manage fibromyalgia pain and other symptoms. This is a quote from a patient named Valerie on Fibro Center's website, and she said, "Fibromyalgia impacts my life on a daily basis, but it isn't my life. My life today is actually better than it was. It's a different life, but it's a better life." So it's really cool to me to see these stories, and there's so many stories of patients like Valerie on Fibro Center's website, and I just think it's really cool to see it's impacting their life, but they've found ways to accommodate their life, and they're still living joyful, happy lives. So what are the common symptoms of fibromyalgia? There are so many different symptoms, and they include pain, anxiety, concentration and memory problems known as fibrofog, depression, fatigue, headaches, irritable bowel syndrome, morning stiffness, painful menstrual cramps, sleep problems, numbness and tingling in the hands, arms, feet and legs, tender points, and urinary symptoms such as pain or frequency. So out of all of those, the most common symptom of fibromyalgia is pain. So to go into the pain a little bit more, in fibromyalgia, widespread pain is characteristic of almost all people with fibromyalgia. In fact, pain is usually what forces a person with fibromyalgia to see his or her doctor. That makes total sense to me. You know, if you're in severe pain, you want to get out of that pain. So that's usually the trigger for people that causes them to seek help and go to the doctor. So unlike the joint pain of osteoarthritis, fibromyalgia pain is felt over the entire body. The pain can be a deep, sharp, dull, throbbing, or aching, and it is pain that's felt in the muscles, tendons, and ligaments around the joints. The Arthritis Foundation describes the muscle and tissue pain as tender, aching, throbbing, sore, burning, and gnawing. For some people with fibromyalgia, the pain comes and goes. The pain also seems to travel throughout the body. So I thought this was a pretty neat chart of how the effects of fibromyalgia are on your body. So if you would take a look at the top, in the central part of your brain, you can get chronic headaches, sleep disorders, disequilibrium, cognitive impairment, depression, and anxiety. In your eyes, you could have vision impairment and weak eye muscles. On your skin, you can have dry skin, itchiness, tenderness, rashes. You can also have TMJ or TMD. In your chest region, you can have costochondritis. In your stomach, you can have nausea, GERD, hypochlorhydria. Lori, you would be able to help me pronounce that. I can't pronounce that. Muscular, myofascial pain, twitches, fatigue. In your joints, there's morning stiffness and generalized pain. In your urinary tract, there's overactive bladder and overactive bowel. And also in the reproductive area, there's you could have heavy periods. You could have your cycle that's less than 21 days. You could have no period, and you could also have fertility issues. These are fibromyalgia could have all of these various impacts on your body. This is another interesting chart of the impact and the effects of fibromyalgia. So you could have memory loss, confusion, poor concentration. You could feel lightheaded and dizzy. You could have spinal burning. You could have irritable bowel syndrome, like I've mentioned before, menstrual groin pain, numbness, and tingling. I think I've mentioned all these, but I think it's really interesting to see it in this chart form. So, the progression and prognosis of fibromyalgia. There was a study involving a huge number of people, about 1,500 people with fibromyalgia, and they were followed for up to 11 years by American rheumatologists. And in the study, they found that there was little clinically meaningful change in the symptom severity, with patients reporting generally continuing high levels of symptoms and distress. There was a slight trend toward improvement, with approximately 25% of patients experiencing at least moderate improvement of pain over time. According to an article on Up to Date by Don Goldenberg, most patients with fibromyalgia continue to have chronic pain and fatigue, although most longitudinal long-term studies of outcome in fibromyalgia have been from tertiary referral centers. We'll learn in just a minute about the prognosis when people are being treated in the primary care setting. One study of 538 patients followed at 6 referral centers found that pain, fatigue, sleep disturbances, anxiety, and depression were essentially unchanged over a follow-up period of approximately 8 years. Similarly, in the author's experience at a referral rheumatology center, there's been little change in the patient's symptoms. So it seems like, based on this information, that the patients with fibromyalgia, their symptoms are just steadily continuing and there's not much change. However, 2/3 of patients reported that they were working full-time and that fibromyalgia interfered only modestly with their lives. And I think that's really cool to see. Even though these people are in a lot of pain and there's so many different symptoms that they're experiencing, they can still maintain work and a happy life. My mom, she's a prime example of that. I mentioned her earlier, and she's a preschool teacher, which is a very difficult job, chasing around 3 and 4 year olds. But honestly, I see that as helpful for her. If she stays busy, it's almost like a distraction from her pain. So, continuing, information about the progression and prognosis of fibromyalgia. In contrast with the patient population studied from the tertiary referral centers, patients treated by primary care clinicians in the community have a much better prognosis, which I think that's really interesting. In one community survey of 141 fibromyalgia subjects, only 35% of those with chronic widespread pain at the initial assessment still had widespread pain 2 years later. How amazing is that? So those primary care providers, they're doing something right. The prevalence of fibromyalgia. The prevalence of fibromyalgia is about 2%, affecting an estimated 5 million adults. It was much higher among women than men, 3.4% versus 0.5%. So as we can see, most people with fibromyalgia are women. The ratio is 7-to-1, female to male. However, men and children also can have this disorder. Most people are diagnosed during their middle age, and the prevalence increases with age. Working age women with fibromyalgia hospitalized for occupational musculoskeletal disorders were almost 10 times less likely to return to work and 4 times less likely to retain work at 1 year post-hospitalization. That's sad, but like I said, they're like in the last slide, maybe some people aren't able to keep their job, and maybe they're not likely to return to work, but there are great amount of people that are able to work even with fibromyalgia. However, if they're working adults with fibromyalgia, there's a great likelihood that they'll be having to take off work due to their severe pain. They were, on average, almost 17 days of missed work per year compared to 6 days for persons without fibromyalgia. Fibromyalgia has been associated with lower levels of health-related quality of life and more work productivity loss. Okay. So as we've already seen, who is most at risk for fibromyalgia? Women ages 20 to 50. So now we're going to go into the psychosocial aspects of fibromyalgia. What role does the psychosocial factors play in fibromyalgia? Well, although the exact etiology and pathogenesis of fibromyalgia are still unknown, there is evidence that psychosocial factors could play an important role. In fact, fibromyalgia has been conceptualized within biopsychosocial perspectives in which physiological, psychological, and social factors are considered as interacting in different ways and at different stages. In a review article, Eck et al. Evaluated the role of psychosocial factors in the development of fibromyalgia, supporting that psychosocial factors can be relevant at different etiological levels, and they can actually be classified into 3 different categories: predisposing, triggering, and stabilizing or chronifying. So based on this information, fibromyalgia is conceptualized as the end stage of an accumulation of biological and psychosocial vulnerability factors over time. So therefore, the writers of this article, Oliveira and Costa, they stress the relevance of considering life stories of fibromyalgia individuals in order to identify key moments of biological and psychosocial deregulation, which can promote the further development of the syndrome and its maintenance once arisen. So this chart is so fascinating to me. You can see they have a list of the different predisposing factors, then also triggering factors, and then the perpetuating factors. So as you can see, the most common predisposing factors in this study were the adverse life events, significant losses, and personality traits. Triggering factors are extended period of physical and or psychosocial stress, traumatic physical experience, and traumatic emotional experience. And then perpetuating factors, once somebody does have fibromyalgia, it has an impact on their family relationships, their sleep disturbances, catastrophic thoughts, depressive anxious symptomology, as well as more things. And I can see all those. Like I said, I'm going to go back to my mom for a minute. Well, and a patient that I recently talked to. The patient that I recently talked to, she told me, she was like, this is not just a diagnosis for me. This impacts, everybody around me, and especially as a female and as a woman, you're usually the caretaker of the house, and you're the person who does the laundry, and you're the person who cooks the dinner, usually, and so of course that has an impact on the people around you, and if you're not sleeping well, then that's going to have an impact on yourself and others as well. So that's really interesting to me. So like I said, the psychosocial factors do have a significant impact on fibromyalgia through predisposition, triggering, and several psychosocial factors happen as a result of the fibromyalgia. So I've already mentioned what those most common ones were for the predisposing psychosocial factors: the adverse life events, significant losses, personality traits, and then the triggering are the extended periods of stress, traumatic physical experience, and traumatic emotional experience, and then the significant perpetuating were the family relationships, catastrophic thoughts, and the depressive and anxious symptomology. Alright, also some psychological factors that may be associated with a better prognosis. There was a study of 198 patients, and they felt like if they had an increased sense of control over pain, a belief that they were not disabled, and a belief that pain is not a sign of damage, if they had that psychological belief, then those beliefs resulted in a better prognosis for them. Alright, there's also several spiritual implications of fibromyalgia. A study was done. They used a whole bunch of different spiritual and fibromyalgia symptom-related questionnaires. And positive relationships were found between symptom pattern variability and uncertainty, and between uncertainty and poor psychosocial adaptation. But the most important one I want you to see out of this is that spiritual well-being moderated the relationship between uncertainty and psychosocial adaptation. So just to, kind of wrap what I just set up, a positive sense of well-being aided adaptation to symptoms and uncertainties of fibromyalgia. Spiritual well-being had a greater effect on the relationship between symptom pattern variability and uncertainty than expected. So basically, it's important, as if a person has a good spiritual well-being, then that's going to impact their symptoms and different aspects of their diagnosis of fibromyalgia. So that's really interesting to me. As far as cultural and diversity issues, we've talked about women earlier. 80 to 90% of fibromyalgia sufferers are women, and so it occurs more often than women than in men. And also a genetic component is suggested, since the study shows that women who have fibromyalgia often had a family member diagnosed with the disease. So that's an interesting biological component mixed in with that cultural and diversity component. Also some cultural influences on pain perceptions and behavior. There was a study done evaluating chronic pain patients from 6 different ethnic cultural groups, and the impact of ethnicity and level of acculturation on pain perception in the Hispanic, Caucasian, and African American persons with fibromyalgia was evaluated in the study, and they found that there was no statistically significant differences across the 3 ethnic groups on total pain perception. However, it was noted that fibromyalgia is likely misdiagnosed or undiagnosed among Hispanics and African Americans in primary care clinics, indicating that there's some implications for the delivery of culturally competent care. In a comparative study of 337 individuals suffering chronic pain, African Americans reported higher levels of clinical pain and pain-related disability. So that's interesting too. Alright, so treatments. How can we help these people with fibromyalgia? Well, there are several different medications. Different antidepressants that are commonly used include amitriptyline, duloxetine, milnacipran, and cyclobenzaprine. There's also a couple anticonvulsants that are commonly used, gabapentin and pregabalin. So the initial therapy for somebody walking in with fibromyalgia would be patient education regarding the disease, which honestly I feel like this is an area in our medical field that's lacking, and it's a really cool part that us as MedFTs can help with. I actually got to help a patient recently, just kind of educating her about fibromyalgia, and so that is so important. If somebody knows about their diagnosis, then I think that can be really helpful for just their treatment and their prognosis, and how they're doing. So also, good sleep hygiene and the importance of treating the comorbidities that may contribute to symptoms, including their mood or sleep disorders. Also, with the initial therapy is an exercise program, including aerobic conditioning, stretching, and strengthening, and also drug monotherapy for treatment of symptoms not relieved by the non-pharmacological measures. So, there's also some treatments. If you try that initial therapy, and it doesn't work, then you can try some combination drug therapy. So some common examples for people with fibromyalgia of the combination drug therapy is a low dose of an SNRI, such as duloxetine, in the morning, with a low dose of an anticonvulsant, such as pregabalin, in the evening. Another example would be a low dose of an SSRI, such as fluoxetine, or an SNRI in the morning with a low dose of a tricyclic antidepressant, such as amitriptyline, in the evening. In patients without an adequate response to these medications or with a temporary need for additional treatment during an exacerbation of pain symptoms, other agents such as acetaminophen, tramadol, and non-steroid anti-inflammatory drugs are adjunctive or alternative therapies that may be helpful. Other antidepressants may also be used in some patients as alternative agents. However, there's less evidence for their benefit than the tricyclics, SNRIs, SSRIs, or anticonvulsants that were cited above. And other medications that have been used in patients with fibromyalgia include opioid, analgesics other than tramadol, muscle relaxants, and stimulants, but there's insufficient evidence for their efficacy or safety in the treatment of fibromyalgia, according to Don Goldenberg. Alright, so some more treatments for patients not responsive to initial therapy: exercise and physical therapy. So some supervised physical therapy program or a personal trainer, water-based therapies may be effective. And in some countries, treatment with balneotherapy, such as immersion in thermal or mineral water, such as spa treatment, is used for treating patients with fibromyalgia. Additional forms of exercise that have shown some benefit in fibromyalgia, but which are not primarily directed at developing aerobic fitness, include mind-body interventions, such as Tai Chi and yoga. Alright, continuing with some treatments, there's psychological therapies. That's where we come in. Some cognitive behavioral therapy, mindfulness-based treatments, relaxation, biofeedback, behavioral treatments, and educational interventions. All of those can also be used to help with fibromyalgia. Alright, so who provides these services? Specialists who provide services for fibromyalgia. The main one, traditionally it would fall under the scope of rheumatologists. However, the more that we learn about this disorder, the more people that have been able to help serve this population. So doctors, podiatrists, osteopaths, psychiatrists, neurologists, and nurse practitioners, as well as us, MedFTs, counselors, we can help with this as well. Alright, so some Eastern biomedical treatments for fibromyalgia include acupuncture and moxibustion. So during this, the local points and areas of the tenderness and pain are needled. And there's also some herbal medicine treatment for fibromyalgia that uses specific herbs to address each of the 3 levels of treatment, but focuses specifically on using herbs that address Bi is the stiffness and blockage of circulation. These herbs also provide symptomatic relief of pain and discomfort. Qigong exercises help correct imbalances in the body and maintain emotional balance. Qigong exercises such as the 8 brocade exercises and Tai Chi Quan encourage gentle physical movement and stretching, thus reducing pain, eliminating obstruction in channels, and maintaining movement. I think all of those seem super cool. I'd be really interested to talk to somebody with fibromyalgia that's tried one of those types of treatment. Alright, and wrapping my presentation up, I just wanted to kind of give you a summary again of what fibromyalgia is and what these people that are diagnosed with it are experiencing. So they're experiencing fatigue, irritability, brain fog, restless legs, overlapping syndromes, muscle and joint pain. It's common for them to not feel good, anxiety and depression, loss of control, grief and worry, immune dysfunction, and a lifetime fight. They're constantly fighting this pain that they're in. So that's the end of my presentation. The next 2 slides include references I used to gather this information.